Here we go.
Where do we start, Nick?
Well, Gary, the leak's behind there, so that lot needs ripping out.
I think we can do that.
Right, Gary, see you in the morning.
7:30, yeah?
Yeah. And that doesn't mean 7:30 Gary time, okay?
Okay.
Mum?
How are you?
Oh, you know, the usual, hard work, dirty, messy.
Thanks for coming.
Sorry I couldn't make it yesterday. I had an emergency. How are you?
I'm all right.
It's a bit nippy out there.
Doesn't bother me.
His sleeping's getting worse.
You are still taking the pills?
I make sure of that. He just can't seem to get comfortable, you know.
Not finished it yet then, Nick?
Well, I'm getting there.
Oh, well, keep up the good work.
Do you want to come through?
Oh, yeah. Just going outside to talk about you.
Makes a change, that, doesn't it?
Sounds worse. Is it?
Difficult to tell, you know, when you live with it every day.
I could give you another prescription.
He wouldn't take it. And even if he did, it's not going to do any good, is it?
Not really.
Mrs. Williams came in yesterday.
Oh?
3 doors down. Well, most of them have been in, actually. I'm becoming quite a celebrity. I mean, it's not every mother who's got a son slowly dying in the front room.
So she's a friend?
Mrs. Williams, sort of. Telling me about her brother. He'd been working with asbestos, you know, off and on. Killed him in the end. Some coincidence, eh?
There is no cure, as I told you last week. It's not the sort of thing you want to hear from your doctor, I know, but...
I've known about his condition for what, 2 months? And then last week you tell me it's probably asbestos related. But I still don't really understand. There was all that fuss a few years ago about the people making asbestos products. The workers and all the ones who died. Nick was a builder. Plumbing, painting, that's what he did. And, well, of course I'm going to say I don't think it's fair, aren't I? But, well, I don't think it is fair.
In my last practice, we had quite a few patients who used to work for a company making insulating materials out of asbestos. And several of them contracted either lung cancer or mesothelioma. In most cases, it took 30 years or longer to show itself. But some of my partners also had patients like Nick, general builders, carpenters, electricians, who'd ended up with the same diseases. And in one case, the disease showed itself much earlier. Same as Nick.
So you're saying Nick was unlucky? I think that's a bit of an understatement.
But it's a question of exposure. The more exposure you have, the more chance you have of being unlucky. Asbestos is fairly harmless if you leave it alone. Once you disturb it, release the fibres, and then breathe those fibres in.
But not 8 hours a day, 6 days a week.
Maybe, but the fibres are very long-lasting. Once they get to the lung tissue, they can't be dissolved or broken down over time. So the problem is cumulative, more so if the worker's a smoker. An electrician goes on a job, breaks through some ceiling tiles containing asbestos, breathes the fibres in. The next job he goes on, he has to chased some cable into a wall. The wall covering also contains asbestos. More fibres breathed in. So the problem just keeps on building up.
You can't be sure, though. I mean about Nick.
I can't be certain, but as I say, I've come across lots of similar cases. And when Nick first went into hospital, he told them that he was always working on different kinds of materials.
But he was always so careful at work.
I'm sure he was. The thing is, he may not have known he was working with asbestos. Although most of it's been banned for years, it's still everywhere. Thousands of tons of it. Floor tiles, ceiling tiles, rope, gaskets, sprayed coatings, cement, insulating board, plaster. Some materials are worse than others, but if you don't know, you can't tell. It's in factories, schools, farm buildings, hospitals, shops, office buildings, public libraries. It's even in people's homes. Everywhere.
I don't know.
Mum! What's the bloke have to do? To get a cup of tea round here, eh?
You'll be pleased to see you.
How are things? About the same?
No, not really.
How are you today? I saw Bill and Terry. They asked me to pass on their best wishes to you, you know. Nick? Bill and Terry send their best. So how are things?
Don't take it personally. They give him less than a month.
What?
I just wish it was sooner.
I had no idea. So fast.
Towards the end it is. They told me that.
What about the oxygen?
24 hours a day. The machine's running flat out. This is the only kind of sleep he gets. He's on morphine now. That helps. Oh, something I forgot to ask you last time. Whatever happened to Gary? Nick was talking about him the other day.
He moved on a few years ago. I tried to keep him, but you know how it is. I could try and track him down for you if you like.
I think he'd like that. How's the business?
Same as usual. Good times, bad times. Oh, Gwen, I really don't know what to say about all of this.
Nothing to say. Wasn't your fault.
Maybe. I do tell him, you know. I tell all of my blokes. Health and safety is important. I send them on training courses, I give them booklets to read, safety videos to take home, and I provide them with all the right equipment. Then, of course, they go out on a job, someone else's premises. There's the site manager pacing up and down, giving his watch all of this. The job's running behind, his boss is getting at him. I only wish.
Wish what?
Oh, no, it doesn't matter. I wish my blokes wouldn't let all of that get in the way. Stop them taking the proper care, checking everything out first. The people responsible for the buildings I send my blokes into, the managers, you know. Well, for years they've had a legal duty to identify asbestos, and if it's damaged, get it repaired or removed by licensed experts. Or if they decide to leave it where it is, make sure the risks are properly managed. But does that happen on every job?
But Nick did know the dangers. You did tell him. I mean, I thought the problem was not always being able to recognise the stuff that contained asbestos.
Nick's one of the best blokes I've ever had. Careful. He never had any accidents and didn't cause any either. If I'd known he was coming across asbestos on the job, I'd have done something about it, warned him, you know. I mean, I know there are safe ways of working with the stuff. Not disturbing it with high-speed power tools, making sure you keep it wet, cleaning up as you go and bagging up the debris properly, but he cared about the firm. He didn't want to let me down, so if he was under pressure, he'd just get on with it. Maybe he didn't always make sure. You know, is this power drill safe to use? Is this ladder secure? Is this material I'm about to smash into likely to contain asbestos?
I haven't offered you a drink.
No, it's all right, Gwen, I'm fine. Look, I'm sorry for talking like that.
No need to be. Could you give me a hand? Need the bathroom? Alan's come to see you. Steady, Meg. How are you?
Okay, thanks.
Doncaster, eh?
I met this girl. We're married now. I was getting fed up with the building game. She wanted to move back to her hometown. You know.
So what are you doing now?
Managing a DIY store. It's not bad. At least it helps knowing the difference between a hammer and a screwdriver.
It was good of you to come, Gary.
I just wish I'd known.
How could you? Remember this? Keep it if you want.
My 18th. I went to the pub after work and Nick...
It's okay. He would love to have seen you, but he wouldn't have known who you were. The last few weeks he was on so much morphine he didn't know who anybody was. He couldn't walk, talk. He couldn't do anything. Except die, and I'm glad it's over.
When Alan found me and told me that Nick was sick and why, I started thinking. We'd all heard about the risks of working with stuff containing asbestos. But we didn't think about it. Even if we had, it's the old thing, isn't it? You never believe it's going to happen to you.
I don't think Nick would have agreed with that.
About 6 weeks before I left, Nick and I were working on this job and somebody, not one of our blokes, fell off some dodgy scaffolding. Killed him.
I remember Nick saying there was a big fuss, wasn't there?
Yeah. The scaffold wasn't put up right. The bloke shouldn't have been on it anyway. Next day, though, everybody was walking around quietly checking every little thing, making sure they did everything by the book. It affected us. You know, one minute there's a bloke there alive, next he's dead. You learn from it. But this thing with Nick, though, something that takes 20 or 30 years to show itself. I don't know how people can learn from that.
I'll make us a coffee, shall I?
Yes, please. Sorry, pal. Thanks.
Tools? Yep. Gloves, goggles, sandwiches? Yep. Let's get on with it then. What do you reckon that stuff is?
What?
Well, supposing that's asbestos. Or there's asbestos in it, or behind it.
Supposing there isn't.
And we'll all live to a ripe old age, won't we? Tell you what, grab a sandwich. I'm gonna go and find the foreman. Right, Gary, see you in the morning.
7:30, yeah?
Yeah. And that doesn't mean 7:30 Gary time, okay?
Okay.
Mum?
How are you?
Oh, you know, the usual, hard work, dirty, messy.
Hope you took care of yourself.
Oh, yes.